Well, our vaccination program has built a huge wall of defense against this horrible virus, where already 9 out of 10 adults have had 1 jab, 7 out of 10 have had 2 jabs. And today we have an opportunity to go further, to take a further step, because our independent committee of experts, the Joint Committee on Vaccinations and Immunizations, has given a firm recommendation to the government that we should extend our offer of vaccinations to all 16 and 17-year-olds, a universal offer to 16 and 17-year-olds. And I've decided to accept their recommendations, and I've asked the NHS to prepare to deliver those vaccinations to 16 and 17-year-olds as soon as possible.
Can you be sure?
The reassurance that we can give actually comes directly from the clinicians themselves. So they've held a press conference today as well, where we've heard from the Deputy Chief Medical Officer, the head of the JCVI, and Dr. June Rain, the head of the MHRA, our independent medicines regulator, and they are all at one on this, that this is absolutely the right thing to do for all 16 and 17-year-olds. Of course, there's no compulsion in this. Like all our vaccination offer, it's something for people to consider and to decide if it's something they want to do. But we want to make sure that all the best information is available, and that we are doing all we can together to build this wall of defense that already has meant, for example, that there's 60,000 fewer people in the UK that have died from this horrid virus, and also some 22 million infections have been prevented, all because of our vaccination programme. 16 and 17-year-olds won't need consent from their parents, and that's because already in the UK, when it comes to medication, 16 and 17-year-olds can decide for themselves. The general presumption is that they're just able to make these decisions, and that hasn't changed. So they'll be able to decide for themselves. Of course, they may want to speak to their parents and speak to others. They may want to speak to clinicians, and we'll be making sure that they have all the information that they need. Whether it's extended further from 16 and 17-year-olds to children, that's a decision for the independent JCVI. It's not going to be a decision for ministers, so it will always be clinically led. I should point out, though, a few weeks back, the JCVI did advise government that for those 12 to 15-year-olds that are at risk, particularly at risk from COVID, that they are offered vaccinations, and also those children that might live with adults that are immunosuppressed, and also for 17-year-olds that were approaching their 18th birthday. Now, we accepted that. I accepted that at the time, and that's already being rolled out, but today's announcement builds on that. It will be this month, and so the way we're going to roll this out, I think, as people would expect, is working through clinicians, working through GPs, through the primary care networks. Also, we will use hospital hubs. We will use hubs like this in Bournemouth today that I visited, that I was very impressed by, and also we'll be working through the already existing schools vaccination program, which I think will help to bolster this. Thank you.
Hello there, come on in.
Thank you.
Sorry, don't worry, they're not here for you. Have you got an appointment?
Yes, yeah.
You can just...
Working for Dorset Healthcare.
Great. Well, thank you for what you're doing.
That's all right.
Yeah. You probably need lots of people.
Oh yes,
for
yeah.
backgrounds. And
There's a couple of people here, funnily enough, that I
Ask you
used
lots
to
of
work
questions.
with.
And it's great that you worked in the NHS before as well,
Yeah,
because you
yeah.
understand healthcare.
Oh
and-
yes, yeah, definitely,
Yeah,
definitely.
great. It was lovely to meet you. Thank you for what you're doing. Thank you. Take care.
I've done 15,000
Oh, my
vaccines now
goodness.
since January when we started
Yeah,
off.
well done.
So we've
Yeah, think of the difference that you've made together.
absolutely.
on
It's been a great experience.
Yeah.
The people here are wonderful. It's been a very,
Yeah, no,
very
we know
well
already
organised.
from the ONS they estimate 60,000 lives have been saved in the UK, and 22 million infections have been prevented.
But as you say, if you look at
Yeah.
the third wave and the very small effect it's had, it's on the way down.
Yeah.
And yet, the hospitalisations and death rates are fabulous.
It's on its way down, and as you said, even the
be,
hospitalisation, the growth rate started falling
Yeah.
quite quickly now,
So,
and let's hope it stays that
I
way.
think
But
I think we've done very
Yeah.
well. It's been a
the
great,
vaccines
great,
make a
great
difference.
effort.
No, thank you. Thank
100%,
you for what you're doing.
100% has been us.
Yeah.
It's been our great pleasure and privilege to do it.
Yeah, no, great. Thank you. Nice to meet you.
Thank you.